listening to the INL podcast with Graham Bradshaw and Philip Watkins, brought to you by Integrated Nutraceuticals Limited, Hong Kong. We're grateful to have you with us. We hope you enjoy this episode.
Hi there, Philip Watkins, naturopath and Director of Education here at INL. I'd like to welcome you to another episode of the INL podcast. In this month's episode, we are joined by Dr. Laurena Law. Dr. Lorena Law is a medical doctor from both Australia and Hong Kong. A conventional doctor by training, Dr. Law utilises an integrative medicine approach to managing chronic diseases. Dr. Lorena integrates the best of both evidence-based approaches in functional medicine and traditional Western medicine practices using nutrition, diet, exercise, laboratory testing, supplements, detoxification programs, and stress management techniques personalized to the individual. She believes in promoting health which goes beyond just the absence of disease. Optimizing metabolic, hormonal, and physiological functions has helped many of her patients improving sleep, energy, fat loss, chronic pain, recovery from injuries, recurrent infections, skin disorders, autoimmune diseases, as well as reduced need for drug therapy. In addition to a busy clinical practice in functional medicine and aesthetic medicine, she is also a part-time lecturer at Hong Kong University Space and a presenter to both doctors and the public on topics related to hormonal health, fat loss, nutritional supplementation, detoxification, stress management, integrative approach to aging skin, and intravenous use of high-dose vitamin C. She is certified by both the Australasian College of Nutritional Medicine and the Australasian Institute for Medical Nutrition on the use of intravenous nutrients. She's a member of the International Peptides Society and is currently completing her certification. She is an advanced fellow in anti-aging, metabolic, and functional medicine and is board certified by the American Association of Anti-Aging Medicine. In this episode, we talk all things skin and cover some interesting ground to do with nutrition, diet, and some more innovative new streams of thinking for the skin in general, as well as some of the more prominent conditions such as acne and eczema. I found this really fun to do and learn a lot along the way, and I hope you really enjoy this episode. Hello there, and welcome to another episode of the INL podcast. My name is Philip Watkins, and I'm the Director of Education here at INL. And this month we have a very special guest, Dr. Laurena Law. Thank you so much for joining us today, Lorena. It's a great pleasure to have you here. Now, today's episode is going to be all about skin. More importantly, something I'm really interested in from your point of view is what I'm naming integrated dermatology. And I've just renamed that, so I would love for you to correct me about this. But first of all, you've got a very interesting qualification, and that's in practical dermatology. And maybe, if it's all right, for those of us who have yet to meet you and are new to what you're doing, maybe could you introduce what that means, and also, where you've trained and what you're interested in?
Thanks, Philip, for having me on this podcast, and hello, everyone. So I actually have to say from the beginning that I'm not a dermatologist.
Okay, excuse me.
That's okay. Not your fault.
I get too excited with my naming.
But it's also can be a little bit misleading because I did do training in practical dermatology, but that's very different to being a specialist in dermatology. So that's not what I am. But what I did was, when I first ventured into skin health, I actually came from more of a aesthetic perspective. So I'm a GP by training, and I actually became interested in aesthetic medicine because at the time, and this is going back more than 10 years, in Hong Kong, a lot of beauty centers were doing skin treatments. And doctors were also becoming much more interested in injecting Botox and fillers for anti-aging and for cosmetic purposes. So I'm always very cautious about these new therapies. They're not new now, it's very commonplace, but because it comes from a different angle of enhancing features rather than treating disease, I wanted to make sure that I wasn't treating people who have a skin condition that could be worsened by cosmetic treatments. So I decided that I needed to learn more in depth about skin conditions and skin diseases to equip myself when I'm actually consulting with a patient to tell them about certain risks and problems that they can have. So practical dermatology is actually a course that is done here through the Hong Kong Medical Association, and it's recognized by the Medical Council in Hong Kong. And it allows GPs or other medical professionals like myself who are not dermatologists but want to learn more about dermatology and skin diseases. Because in general practice, we see a lot of cases like eczema, acne, psoriasis, those types of conditions. And I think it's important that as GPs, we know when we need to refer those cases on if they're not easy to manage and if there are complications. So that's the reason why I went into it, because as a GP I was interested in skin health, but secondly also because doing cosmetic procedures I need to be aware of people's skin conditions so as not to make them worse. So that's the reason why I did it. So I wanted to just make sure that people understand I'm not dermatology, we really have to, it's an extra 4 years of full-time training, whereas practical dermatology, it's a year of studying.
Still, I think it's really interesting to pick up on a point for you that in Hong Kong, the types of skin conditions that I've seen just through my own clinic have been quite aggressive. And I wonder if you have a comment on that, in that the idea of actually knowing more about it and being able to identify when to refer and when to actually enlist the help of someone who's had that 4 years is actually a lot more serious in a way to describe it here, as there's a lot more infectious eczema and things like that. Do you have a comment on how you've seen, I guess, specifically skin within Hong Kong and skin diseases as opposed to where, some of the other places where, you might see it?
Yeah, so the difference really here, as opposed to Australia where I did my undergrad training, is that we don't tend to see as many skin cancers in the local population because of the skin type and also because of the difference in latitude. We're less, I guess locally Asian people don't like to be exposed to sun, so they don't tend to sunbake as much. But in Australia, because we are much more exposed to sun and because of the type of skin, more type 1 to type 2 skin levels, there's easier burning, so there's much more effect from the sun's UV radiation. So I tend to see a lot more skin cancers and melanomas in those populations. However, there are expats who live in Hong Kong, and it's a very international city. So if I do have patients who perhaps may have a malignant or a cancerous looking like mole or a skin rash, then I would refer to my colleagues who are dermatologists and ask them to check it out and monitor them. And sometimes even if they need a biopsy, perhaps to confirm that it is a cancer or not, then I would refer on. So I don't treat those types of cancers myself. And also if I feel that the patient's eczema or acne is getting very severe to the point where they're probably going to get very serious side effects, and sometimes they're going to be scarring, for example, then I think it's important that they get referred to somebody who can closely monitor them and give them the best treatment as fast as they can to heal and get the condition under control. So I tend to see cases that are a bit more chronic, mild to moderate, where perhaps they've already gone through the whole spectrum of conventional skin therapies and they haven't really responded well, or they've responded partially but not completely. And those patients are interested in looking at what nutrients or what other areas in their lifestyle may be impacting their skin health. So that's why for me my own interest is in the area, because a lot of those scars that appear as a result of chronic skin conditions can benefit from topical therapies. So I'm talking about creams or chemical peels or lasers or any type of energy-based devices. But it's very important that the skin condition is stable and whatever treatment that we're doing to improve the scar or the appearance of the scar isn't going to make the skin condition worse.
Indeed.
Or add extra complications. So that's the area that I'm interested in. But also at the same time, I realize that a lot of skin conditions have a lot of dietary and lifestyle issues do impact on skin. And the reason is because I started to see a lot of adult acne appear here, and it's interesting because often the women come to see me and they're complaining that they're not teenagers anymore and yet they're still suffering from acne. Now sometimes they have already a history of acne as a teenager and they've been on medication such as Roaccutane and sometimes antibiotics, but often they actually present first time in adult life with acne. So one of the things that I would look into are things like polycystic ovary syndrome, because that's actually not uncommon. And it's actually becoming more and more common, and we're diagnosing it more and more. Back in 20 years ago when I was a medical student, we weren't really hearing a lot of it. And so we're seeing a lot more women suffering from that. And I think it's important that that's excluded, because often these women go to other non-medical places and try to have different types of treatment, and yet the underlying condition or the problem is a hormonal issue. And so they don't really get good control of it. So that's why even though I see skin, I don't look at just the skin but beyond. And that's the reason why today I wanted to talk a bit about people coming to see me because they have scars, they want to improve their appearance, but actually I also talk to them a lot about internal health and internal anti-aging, and what does that mean and how does that impact on their skin.
You mentioned that, and I find that really interesting. I think one of the bringing up acne vulgaris is one of the more interesting things to look at, I guess, first of all, when we're talking about skin conditions, mainly because it's actually, I think we're seeing an increase in prevalence in adult female acne as well. Is that correct?
Yes.
And I think the interesting part about the metabolic side of acne and PCOS as well is that there's a huge kind of insulin and metabolic component to that as well. So it really seems like nutrition is in some way, when you break that down, the first point of call. And when you sit down with someone, I mean, what are the first things that you tend to think about when you're maybe assessing someone for the first time?
So the first thing I do is I like questionnaires.
Yep.
Because I like to ask people about everything, and often it's interesting because I sometimes get feedback that the questionnaires are too long, but then other times I get feedback that actually people didn't realize they had to think about things like sleep or their gut health or what they've had done in the past. Have they taken antibiotics? How's their immune system generally? What kind of food do they eat? And as they're filling in the form, they actually become more aware that there are certain lifestyle issues that they may be able to improve that could then improve their skin symptoms. So I often start with that, and I go back even to when they were in their teenage years and their childhood years, because I want to know, were they breastfed? Did they have a lot of antibiotics? Did they have a lot of skin conditions or skin allergies? Because I think we know now that for eczema, for example, if we are able to improve the mother's immune system with probiotics, that can actually lessen the chances of children getting childhood eczema. So I think going back even to that level gives me an idea as to how good was this person's gut health and how diverse is their gut microbiome, because we're now more aware of the fact that gut health actually has a connection to skin health. And in fact, it was probably around about 80 years ago that there were two dermatologists called Stokes and I forget his other name, Pillsbury. So they actually coined the term the gut-skin axis. So they actually hypothesized at the time that people's emotions impacted on their gut flora, which then affected their skin health. So that was amazing for two doctors who didn't know anything about gut health as we do now.
And so early too,
to hypothesize.
As well.
Yeah, so I like history because I like to look at what other doctors generations ago thought, and that's pretty much where I feel that the research is now going, is confirming a lot of these things, and we're understanding more about the pathways and the mechanisms. And so when we go back to acne, I look at all that history, because we know that things like stress and low stomach acid, certain toxins in the food that we eat, and chemicals in the environment can impact on the diversity of our gut microbiome. And that can impact on how well that gut barrier and immune system functions, which then connects to the pathways. So one of the pathways that is very interesting, and it's not often talked about, has to do with neuroinflammation. So there is a neurotransmitter called substance P, and this particular neurotransmitter is not often talked about, but it links neuroinflammation in the gut to the skin. So when this neurotransmitter is triggered, you actually get more inflammation in the oil glands, and it also causes the skin microbiome to become more inflamed. Wow. So I think like we're understanding more of how these relationships are working. And again, there's so much more research, even just talking about gut permeability and how food and the types of food that we're eating, even though they could be healthy, can trigger an overactivation of the immune system, because the more our gut becomes permeable, the less it is able to balance the immune system. So in the past, when we read about acne, don't eat sugar or chocolates or cheese or certain types of foods. And we weren't really able to pinpoint or identify a particular group of foods, because everyone's immune system is different, because everyone's diet is different. So that's why I think there's always been a bit of confusion about, should you exclude foods or eliminate certain foods if you have skin conditions. And I think it depends on the different types of skin conditions, and currently we do have some observational studies that, for example, with acne, it's foods that are high in sugar, and for eczema, for example, it could be dairy, and sometimes for psoriasis, we've actually seen an association with gluten, and with rosacea, not so much, spicy food with rosacea. So we're really starting to see like some commonalities in the different disease groups, but there's also a lot of variability amongst different patients. So I often go through a patient's diet. I ask them what do they eat often, and do they have other symptoms apart from skin symptoms? Do they have bloating in their gut? Do they get joint pain? Do they get chronic fatigue? Do they have sleep issues? Do they have reflux? So I ask them about these questions, and then I put together what could be a triggering issue for them, and work out how severe is their skin condition, how frequent they're experiencing it, what other treatments have they had from other doctors, and work out a way of changing their diet, getting them to focus on some areas like sleep, for example. But often I find that some patients are, especially here in Hong Kong, people are so busy and they have so many things to do, even in the early hours of the evening, that some people are just getting 4 or 5 hours sleep.
It's fascinating, isn't it? Because I think what I'm hearing from that is that we're starting to really get diet as a prescription, as opposed to your diet for human optimization, let's say. And I think this is you brought up a really interesting point, in the sense that I think where I'm seeing, and I'd love to hear your opinion on it, is that we're now actually getting to a point where a diet prescriptively may be, a 12-week kind of, at least a 12-week beginning, where you need the diet prescriptively to underpin any of the other types of interventions. How do you see that play out when you say change someone's diet? What kind of things do you see, a particular time frame that you rely on, or you advise your patients, hey, this isn't magic, you're not going to not eat bread for 3 days and all of a sudden everything's going to be okay? How do you tend to manage people's expectations in relation to how much diet can do, and maybe any other things you offer people in that regard?
So it depends on where they've started from, because sometimes people they're used to the modern type of diet, where in Hong Kong you go to a cafe, you order instant noodles and spam ham for breakfast, and then in the afternoon you order your the afternoons are not too bad, but they tend to have a lot of sauces and additives, and then at night time maybe that's their healthiest meal, where they're cooking vegetables and rice and some lean meat at home. But the first thing I try to do is see where they're at in terms of what they understand about their diet, and if they are drinking a lot of soft drinks, for example, which is really common as well, then I sort of then I would educate them about maybe cutting that out for a period of time, and instead of having soft drink, let's increase their water intake. Maybe if they don't like the taste of water, put some lemon into it. So really be very specific about why I want them to cut out soft drinks, because it's so processed. Even though these days we have sugar substitutes, there is still some evidence that it could change the gut microbiome. And if there's somebody who's been taking antibiotics for their coughs and colds or their ear infections when they're young, then they probably have quite limited gut diversity. And so their gut health may not be so good. So I want to minimize, and I think if I can minimize some of these things, and also at the same time focus on things like water, because often people forget to drink water. They get so busy in their day-to-day that and sometimes they don't drink water because they don't want to take a toilet break.
It's pretty crazy, isn't it?
It's actually really incredible.
Yeah.
So I did have a patient like that who was in her 30s. And I said, well, what's happening to your gut health? And then we talked about, how constipated she was and how her bowel movements.
Wow. Okay.
And I said, well, actually, are you eating fiber? Well, and then she had all these issues with her diet as well, and she had no time to eat. She was a lawyer. and she was coming and she was seeing doctors and taking antibiotics for her acne. And I said one day, well, how much water are you drinking? He said, oh, I'm not really drinking water because I don't want to go to the toilet because I have no time to go to the toilet. So I said, if you just drank this amount, 8 glasses of water, we agreed on. I think she was only drinking like 2 glasses of water a day. The rest was coffee, or that's it. And so I said, why don't we increase your water intake to what you optimally need? And she was like, but I then need to go to the toilet.
I've had exactly the same patient, and they were constipated as well.
Yeah, exactly. And
it's hard to know where to start in that conversation. Because
what we're used to, what we know is optimal, or what we see is optimal, is so far from what their reality is, that I really had to sit down and say to her that, okay, there's a few things. You have a lot of toxins in your body. You do have to get rid of it. Ideally, if you're eating every day, you've got waste products, so you want to be going to the toilet every day, at least a minimum. So I actually had specific goals of their bowel movements and their water intake, because that's really important healthy function. And unfortunately, we're not really taught that at school, or in our adult life. We just accept that and we're embarrassed to talk about it. Like, she was really embarrassed about talking about her bowel habits. So I said, don't be embarrassed. I hear everything about people's body functions. That's why you're here. I'm a health professional. Yeah, we've heard it all before, the kind of internship training that we have. We had to check everything, really. So, yeah. So don't worry about that. So, and so going from where they are, meeting them where they understand, and really just making them not feel embarrassed about these things. I think that's really important. And then just getting them to try at least for a couple of weeks. And I think it depends on their age as well. Like, if they're younger, they tend to respond faster. And if they are doing other things at the same time, like some people may be able to say, okay, I'll sleep more and I'll drink this much more water, or I'll be able to, maybe cut out this particular processed food, then they might start to see an improvement even as fast as 3 weeks.
Wow.
So I don't stop there, and I don't say, okay, now you can go back. But I say, well, that's just the start. It just means that you're on the right track, and we're on the right track in terms of your lifestyle changes. So why don't we keep doing that, and then maybe consider other foods that are actually healthy that you can incorporate. Because I know that sometimes we often focus on, let's eliminate foods, but we also need to focus on, well, what about eating more whole foods? So that's one thing that I talk about often with patients, is what's considered a whole food, and also what's considered healthy fats, because I think we grew up in a society where we demonize fats, and then now we're demonizing carbohydrates.
It's really full on, isn't it?
It's very full on, and we're demonizing macronutrients. So I think we might have gone a bit far there. So I don't really talk about those types of things. I talk about food quality, because in cities, convenience food is so much cheaper. It's there all the time. It's very difficult to resist. So to make an effort to invest in our health, I think we need to understand what is a whole food and what's considered whole food. What's a good fat? What can I eat more of? So I talk a lot about fatty acids, and that's very important for things like eczema. And our cells are made of fatty acids. So every single cell in your body has phospholipids, which are the outer lining of your cells. So I make it really simple for patients to understand. And I would say, look, I would recommend that you try some flaxseed, for example, or eat salmon, or have a handful of nuts, or 10 pieces of nuts a day, or try pumpkin seeds, and try to get them to incorporate foods that actually traditionally they eat, because in Asia we have a different kind of food diversity. So trying to encourage them more on eating those types of foods, and just getting their digestion and their bowel movements going, I think makes a huge difference.
Especially if there's a hormonal element to that as well, with if people's colon and bowel are a little bit out of whack, so to speak. Then obviously with enzymes like beta-glucuronidase and some of the estrogen metabolism as well. Thank you, Carrie Jones, if you're listening.
Yes, thank you, Carrie.
Hi there. These things can be really major parts of how someone's skin would present. You mentioned substance P. And substance P has actually been a very big interest of mine, because I believe mainly because of pain perception. But can you maybe elaborate a little more, if you can, on what substance P is, maybe as far as a neurotransmitter, how maybe it might affect people's skin a little bit more, for those who are interested, because I find this one a real fascinating one. And out of the neurotransmitters, we've got our favourites, and serotonin and dopamine, but this poor old substance P doesn't really get the audience that it needs. But it's also modulated by quite a few nutrients as well. So I mean, could you tell us more about how this all might relate?
Yeah, so when I actually looked at the gut-skin axis, that was one of the pathways that ties in gut health with skin health, because substance P actually appears in both these areas. And so it is actually a mediator of inflammation in the gut and in the skin. So there are things that trigger it. So for example, in the gut, it's something called lipopolysaccharides. So these are actually particles that are released from the gut microbiome, so gut bacteria. And if it actually crosses the gut barrier, it can actually trigger substance P to be released.
Okay, yeah. So we're seeing that low-grade chronic inflammation starting to appear there.
Yeah, so it does increase the trigger of the immune system. So then you're getting a lot of histamine, mast cell release. All those pathways are actually being triggered as a result of it. So we often don't think about neurotransmitters being an inflammatory mediator. We often think about other types of inflammation. But when we actually talk about this, it's a kind of neurogenic inflammation that we're referring to. So even things like nerve pain, for example, can be mediated by this. But in the skin, it's actually more to do with inflammation, because the actual ducts in the skin where you get the hair follicles and where you get the sebum secretions, they're actually nerve endings in that area. So if substance P is released in those areas and you've got even just a sebum, pocket of sebum sitting there, and it's actually not being released into the skin as it should in healthy skin to protect it as a barrier, you can actually get inflammation even just by that.
So locally within there?
Locally in that area. And of course, then there is an association with Propionibacterium acnes.
Yep.
Very long name.
Cutie bacterium.
Cutie bacterium, so the name's changed.
Hard to forget that one.
Yeah, so and the skin microbiome again is another area of discovery.
Yeah, the topical creams now
has probiotics.
Yeah, so
I've yet to try it, but
me too. Yeah, I think that's a really interesting one. I mean, so you've touched on diet a little bit. I mean, you've obviously got a wealth of knowledge through the aesthetic side of things, and also obviously with some of the other interventions. Let's say we move to stage 2. I've come back, I've spoken to my boss, and I've been allocated 3 toilet breaks a day with which so I can go and then drink 8 glasses of water. Where do you go then? Are there particular tests that you like to do? How do you maybe do further assessments if it's applicable?
So it depends on the patient, because sometimes if they're very compliant with their strategies, then I don't necessarily test.
Sure.
But I will consider very often frequent deficiencies that I see in the general population. And there are things like vitamin D deficiencies and even zinc deficiency. These are really common, and they often have an overlap with other fatty acid deficiencies. So I often will do a physical examination. I think it sounds a little bit odd to do a physical examination for nutrient depletions, but it's actually quite interesting. If you look at the skin and you look at the fingernails, you'll actually see something called leukonychia, which is white spots on the fingernails. So I mean, sometimes it's hard because they have their nails painted, but then I check their toenails. So if
check mine at the same time.
So I'm often looking at people's fingernails and looking for white spots, because they can indicate protein deficiency or low stomach acid or zinc deficiency. And if I see vertical or horizontal ridging, I check for that, and I ask again about their symptoms. But I also, some of the skin conditions, like for example psoriasis, you'll actually see the nails being affected as well. So it's important to look for other skin conditions that may be correlated. So I get a lot out of that. I also look at their tongue. And sometimes they think that I'm a Chinese medicine doctor because I'm looking at their tongue. But specifically, I'm looking for white coating of their tongue, because that can be an indicator of poor gut health.
Sure.
And sometimes they report having bad breath. So then that could, to me, signify maybe they've got some reflux issues or low stomach acid issues, or even potentially a type of bacteria that's actually very common in their guts and often associated with, and can be confused with acne, which is acne rosacea. So they have a very similar pattern, but the disease is slightly different. So I would look for those things. And so there's another skin condition where you get this kind of plucked chicken skin type of bump that you can see on the outer side of your arms. It's called keratosis pilaris. And we often associate that with a vitamin A metabolism issue. Okay. So those are the common things that I would check for. And the other one that I often will ask about is a sense of taste and smell. Sure. Because that's often perhaps low in zinc, so they're not really tasting their food, so they're like wanting to salt their foods and wanting to eat very sweet foods or salty foods or very processed foods. So some of these things can give me a clue, and if they do look like they are having certain deficiencies, then I would suggest that they do a nutrient test, because sometimes we can pick up low levels, and if we actually replete them, their skin conditions can improve. But Having said that, I also the research also shows that sometimes it's still worth trialing certain nutrients even without a deficiency, because they can be therapeutic for a short period of time. So more here I'm referring to vitamin A for a short period of time in a short course in some patients with acne, because that can really help to calm down the inflammation. So that's one thing that but we have to be very careful of that because of liver function, and also with pregnancy with high doses.
Do you have any particular guidelines with vitamin A as well, like as far as how you're dosing that, and maybe how long I mean, obviously it is a case by case as well, but do you have any general guidelines that you follow when you're helping people with vitamin A?
Yeah, so with vitamin A, I'm very cautious, because if they're women, I ask them, are you planning to be pregnant? So if I exclude that, then I would usually make sure that their liver function is good as well, and that's really important. So I tend to start I'm very, very cautious, so I tend to start around 10,000 units, but I can sometimes go up to 20, and I would probably do that for a couple of weeks. And just see how they're responding, because even sometimes you can get things like irritation of the skin and peeling of the skin and dryness and dry eyes and dry mouth, and so those are some of the side effects that we really have to watch out for. And so if they're able to tolerate that and they're getting good control of their inflammation, then the next step is to see like what is the lowest dose that they can go to continue to manage that.
No, that's fascinating, and I think one of the things that I'm really hearing out of this is that a lot of the time, especially with skin, and once again you may be able to comment on this, is that it seems to me that it's gotten to the point where people are looking for incredibly sophisticated, ways of helping, where really you've outlined here that nutrient deficiencies from a poorly nutrient oriented diet, let's say, can actually play a huge role in how the body, generally deals with a lot of these things. And interestingly, vitamin A has a big role to play in the gut as well. So there are, what you're doing there is really, looking at that skin axis and then the resources it requires in order to manage itself. And this is really just doing the basics well. I mean, how many of the crazier treatments have you seen? I'm sure you must see quite a lot of crazy stuff, but I mean, are there any interests or maybe more innovative streams that you think may actually have some credence behind them? I mean, I know that we're starting to see lead levels, become quite a lot more important. I mean, maybe more so in Hong Kong with people who are presenting with particular forms of atopic dermatitis or anything like that. But aside from that, are there particular streams that you're seeing, okay, well, maybe this isn't as crazy as it seemed initially, and, more just to get a sense of maybe it might go somewhere?
I think we're probably seeing a move towards therapies that modulate the immune system. It's not, I wouldn't say that they're crazy, because they have been traditionally used in skin conditions. So for example, like the autoimmune kinds of skin conditions, like psoriasis. We as doctors, we do use disease, like very toxic drugs, like pretty much cytotoxic drugs in these conditions. So you might say they're crazy, but because these autoimmune conditions don't just affect the skin, they also affect joints, and they also affect nails, they also can affect internal organs. So the severity warrants a certain level of treatment. But I think because we're now understanding that some of these conditions are autoimmune related, we've become much more interested in looking at the immune system as a whole. So there are definitely interesting therapies that are out there, and one of the interesting things that I'm seeing is the use of peptides in skin.
Yeah, right.
I mean, that's been around in the cosmetic industry for a long time, where you have peptides in topical creams and skincare products, and then you apply it.
I've seen this before.
So you've probably seen that in those areas, but that research has been around for quite some time, and we're now becoming more refined in the kinds of peptides that we have access to. So now they're injectable forms, And some of these forms actually have specific signaling mechanisms. So if we go back to what peptides are, they're chains of amino acids, not more than 50 strings altogether. So some are smaller, some are larger. And they actually in our bodies are natural. They occur naturally. We have them. And they're signaling messengers. So they send messages to our cells to then replicate parts of the DNA to then have an action. So these are signaling molecules. And in the general health industry, so we're talking about disease treatment, a lot of the research is being done in cancer therapy.
Okay.
But if we're talking about in skin, there's actually a lot of these peptides that are now injectable into the skin.
Wow, okay.
So one of the really interesting ones for anti-aging is copper peptides.
Yep.
So copper is something that is important for skin repair,
Sure.
skin signaling. It's important. It's a really important molecule that helps the skin to repair itself. And so we see a lot of that in skincare products, but also in the form of injectables. So other peptides also, there's so many of them, and they're all they're all oligopeptides, different numbers, different ones have different signaling cascades, but some actually help to reduce the overactivity of melanocytes. And the reason is because in Asia, I see a lot of people, Asian skin tend to have a lot of post-inflammatory hyperpigmentation or pigment disorders, just because our skin type is much more sensitive to UV radiation. And as a result, melanocytes are created to protect the skin. So, and they tend to stay for a lot longer. There are also congenital types of skin conditions called nevus of Ota, nevus of Hori, that are not life-threatening, but they are a cosmetic concern. So there's a lot of research into these products that are blocking the production of melanocytes, but also the melanocytes themselves have melanin that transfer pigment into the layers of the skin. So there are specific signals using peptides that we can send to those pathways to block it.
Wow.
So it's a really interesting area of research.
That's super interesting.
Yeah.
And
yeah.
it seems to me that one of the cool things about that is that we're still using what seems to be, I mean, correct me if I'm wrong, because sometimes I am, that we're still using naturally occurring substances in a sense to have a more, I guess, specific, target.
Targets, yeah.
And I think this is where I'm actually loving a lot of these directions where we're gaining new understandings. And I really just wanted to pick up on something you mentioned just before, in that, even with peptides and some of the more specific kind of targeting that you're looking at, you've just really ticked a box there in saying that, hey, the immune system's now really, really important. And our knowledge and application of how we can help the immune system seems to be that, okay, well, you've got an autoimmune condition, maybe the cream's not going to cut it. Maybe we need to modulate the immune system a little bit more, and then kind of, move ahead with actually, I guess, what I heard was the origin story of why that's happening. But are there any other areas where peptides have been? I'm super curious. Are there any other areas that you've heard that peptides can help people?
I think other areas, for example, are probably a lot of the research that's been done is in athletes, because the kinds of peptides that often, I think because athletes are also the types of people who need to recover really fast, and because they're also stressing their bodies at a much higher rate, then the search for things that will help improve recovery and also shorten the time of injury has been quite of interest. So there are definitely peptides that help to improve joints, connective tissue, ligaments, fibroblasts. So it can even cut down the time of the athlete needing to recover. So there are different kinds of those peptides around, and some are oral. So not all peptides need injections, but they're oral. And I'll have to say that even for skin, you can take certain peptides orally. And that's actually been around for quite some time. Okay. But the initial hypothesis was that, like collagen peptides, that whatever collagen you ingest actually goes to the skin, but it actually doesn't, because the collagen is a signaling molecule.
I'm glad you brought that up. Yeah.
So there's a lot of confusion. People often ask, is there any benefit in orally consuming collagen? Does it go to your skin? Well, what you consume doesn't go to the skin, but it signals the skin to make better ones. So that's really the short version of it. And collagen is actually not just in the skin, it's in the gut, it's in our joints, in our connective tissue. So there are different types of collagen. So I think that's probably an area of further research, because we're much more able to pinpoint and refine and purify peptides and really target so specifically the signals that we want to switch on.
This is fascinating. Look, I just want to say thank you so much for joining us today. I have one more question, if you don't mind. Let's say I'm new to using a more, I think, dare I say, broader approach to treat my skin. One, I'm going to step in and say, see a practitioner who knows what they're talking about first. Okay, that's done. But if there was a way to maybe take some personal responsibility as either a patient or practitioner potentially, do you have any comments on where you would generally, maybe a parting message for, what you think might be best for someone to help with their skin?
I think the most important, I guess the most important thing is actually sleep.
Yeah, I love it. Yeah.
I find that whatever you do, whether it's nutrients or whether it's drug therapy, whether it's topical therapy, in my more than 10 years of experience, the people who come to see me, whether it's for aesthetic treatments or skin condition treatments or acne scars or blemishes, I find that the ones who respond the fastest or maintain their skin health for the longest are the ones who actually have adequate amounts of sleep and manage their stress well. Wow. Yeah, so I have patients who've seen me for 10 years and they have better skin condition now than they did 10 years ago, and compared to their own peers, they have better skin because they have taken the holistic approach. Wow. And looked at stress and sleep, and these things are free. Really, they don't cost anything.
But it's true though, right? And I think it really reinforces the message that you've offered throughout this episode, which is more that don't think the basics don't work. And I think the encouragement towards educating people from a practitioner point of view to our patients as well is to say, hey, we love sophistication, but make sure that you're offering people ideas about how sleep, for example, is a really big thing. Dr. Lorena Law, thank you so much.
Thank you, Philip.
It's been absolutely a pleasure to join you today, and thank you for very much being a part of this. Now, if you'd like to get more information about your practice and how to contact you, is there somewhere that you'd like people to go to maybe book an appointment or get some more information about where you practice?
Sure. So I have a social media account, so you can follow me on doc_Lorena, that's Laurena, or you can contact me at Life Clinic, and you can Google search that, lifeclinic.com.hk.
No problem.
So if you have any further questions, sure, you can email me and contact me through there.
That's great. Well, once again, thank you so much for joining us today.
Thank you, Philip.
And this was an absolute pleasure. More questions on the way.
My pleasure.
Thank you.
Thank you.
The INL podcast is brought to you by Integrated Nutraceuticals Limited, Hong Kong. If you want to know more about INL, natural medicine, or how to unlock the potential of our range, simply go to www.inl.asia and sign up for our newsletter, or simply browse through our education section to see what you can find. We'll be back soon with another episode. Thanks for joining us.